delivered by Dr. Susan Frampton. She's the Blantree president. Blantree, as you all know by now, it's a nonprofit advocacy and membership organization that works with a growing network of healthcare provider organizations across the communion to implement comprehensive person-centered models of care. Dr. Susan, the floor is yours.
Good morning. Good morning. Very nice to see you all this morning. I really wish that I did speak Arabic because I could tell that I missed a very inspirational story. But sometimes we can understand things. We don't need to actually understand the words. We can understand by watching that person and the reaction of the people around them. So in many ways, that's a wonderful introduction to what I'm going to be speaking, to what I'll be speaking with you about this morning, which is the importance of connections between quality and safety and compassionate practice. Let me begin by sharing a brief story that I think illustrates some of our challenges still around this connection. About 10 years ago, Blantree was working with the Cleveland Clinic on their Patients First initiative and working with their first patient experience officer, Dr. Bridget Duffy. And I remember she shared a story with me. She thought she was making a lot of progress. She had done many educational workshops for the medical staff, talking about patient-centered approaches to care and the importance of respect and compassion and empathy. And at the end of one of those presentations, one of the surgeons came up to her and he said, "You know, my patients should just be happy to get off my table alive, and now you want me to be nice to them too?" And she was taken aback. And often I remember that story because for me it was symbolic of the way that we have traditionally defined quality as a technical outcome, a good outcome from good technical skill, very much disconnected from the human relationship and the importance of that human relationship. Several years later, I remember sitting in my own physician's office waiting to be seen because this was an environment that still had waiting spaces and you were expected to sit and wait in them. And I picked up a copy of the New England Journal of Medicine that was there in the waiting room. And I have to say I was both surprised and delighted to see this editorial in the front of the magazine. And the title of it was "Putting Quality on the Global Health Agenda." And it was an editorial about the importance of empathy, compassion, and respect, and treating patients with dignity and respect as the foundation of a quality healthcare experience. And it went on to talk about the fact that we can have the most sophisticated medical technology. We can deliver excellent clinical outcomes. But if we don't treat patients with dignity and respect, they're not going to come and access those services to begin with. And in many environments around the world, we still have this challenge. This was the challenge in many ways that led our founder, Angelica Thiriot, to begin a patient-centered care movement. Because in her own experience, while she believed she got the best clinical care possible, she did not get a very patient-centered care experience. And her challenge to healthcare was to hold itself responsible for providing not only the best quality, the highest safety, but also the best patient experience that focused on respect between people, control, warmth, and a supportive care environment. And so I want to talk this morning about compassion. And I do believe that most of us in this room would define ourselves as compassionate people. If I asked you to raise your hand, if you're not a compassionate person, I don't think we'd see any hands raised. We go into medicine, we go into the healthcare field out of a sense of wanting to help our fellow human beings. And so I think that we all recognize this concept of compassion, of this deep sympathy for our fellow humans and wanting to do something to help, to alleviate suffering. So I want you to think for a moment about the people in the world that we hold up as icons of compassion. And when we think about compassion, who comes to your mind? If I asked you to make a list of people that embody the concept of compassion, who comes to your mind? I'll tell you who makes my list. Often I think about Florence Nightingale, and I believe Lisa mentioned Florence Nightingale in her talk earlier this morning. For many of us, particularly if you're in the nursing field, Florence Nightingale is on your list of compassionate human beings. I think also of individuals like Mahatma Gandhi, a man whose life was really an expression of compassion for his fellows. I think about Nelson Mandela and the work that he did for equality. I think about Mother Teresa. I think many of us would have Mother Teresa on our list of compassionate human beings. For many of us, it may be our religious and spiritual leaders that we think of when we think about compassion. And this is another person who makes my compassion list. Anyone recognize this person? Now, this is my mother. My mother is on my list of compassionate human beings. My mother was a hospice nurse at the end of her career. She worked with families as they prepared for their loved one passing. And I remember so many of the stories that she shared with me that were the embodiment of compassion, but not always the embodiment of high technology and clinical skill. And I remember one story in particular she shared with me. She was working with an older gentleman who had mesothelioma, and he had perhaps a few months to live. And she would go into his home and work with him and his family as he prepared to die. And they had a very close relationship. They became good friends, and she would visit several times a week. And at one point, this gentleman said to her, "Janet, I want you to be here with me when I die." And she said, I will do the very best that I can to be with you. Of course, I want to be here to support your passing. And as it turned out, he passed away on a weekend when my mother was not working, that she was off. And one of her colleagues was there in his home when he died. And her nursing colleague called her and said, I know that you're not working today, but I think you would want to know that this gentleman has passed away. The doctor's here. He's fixed his time of death. My mother said, "Thank you so much for contacting me. I want to come and be with the family." So she drove to the family's home. She went into the room where this gentleman had passed away, and good nurse that she is, she held his hand. Her fingers went to his pulse, and as she sat with him, his pulse returned. And his pulse beat for a minute or two, and my mother said goodbye, and the pulse stopped. So for me, this was a story that embodied what compassion and what the best quality healthcare could possibly be. It had very little to do with the scientific skill, her nursing skill, much more about the human relationship and the power in that relationship. And our patients, all of our patients know what compassion feels like for them. They may not be able to define or to really understand the aspects of technical skill, of how competent the surgeon is, of how good your MRI machine is, but they understand whether they're being treated with kindness, with compassion, and with respect. This, as I mentioned yesterday in my talk, is one of the three major concerns of patients that we find when we talk with them in focus groups and interviews about an aspect of today's healthcare system that still needs improvement, that we need to continue to focus on how we can help support our own staff in providing that sense of empathy, compassion, and respect to our patients. And I will say that in healthcare in particular, we like the data. We like to see the evidence in order to incorporate best practices. And I also mentioned the other day the National Academy of Medicine initiative that we were involved in over the last year to look at that evidence base for patient-centered care, for patient engagement. And what I want to share with you for the rest of my time this morning is the evidence base for compassion and empathy. And so let me start by looking at some of what the research tells us about clinician empathy and clinical outcomes. Because what we know when we begin to look at the research evidence is that relationships, empathic relationships, can increase patient engagement, they can improve health outcomes. We know from the literature we can teach empathy skills to our staff, and that the extent to which our hospital organizations reward compassionate acts in their staff, it significantly and positively is associated with patients' ratings of that hospital, their likelihood of recommending, and their patient experience. So if we look at the research literature, we find many, many papers that elucidate this relationship between empathy, respect, compassion, and better clinical outcomes, including better management of diabetes, fewer medical errors, better treatment adherence, and faster recovery times, including with diseases like influenza. One of the preeminent researchers on this connection between a physician's empathy and clinical outcomes is Dr. Hojat, who's based in Philadelphia. He has developed a physician empathy rating scale, which is a validated scale, and it's a series of questions that patients use to rate the empathy of their physician. The work that Dr. Hojat has spearheaded has looked at patients' ratings of empathy, how empathetic they believe their physician is, and their clinical outcomes. And he's done this particularly with diabetic patients. One of his early studies looked at primary care physicians and the hemoglobin A1C scores of over 7,000 diabetic patients. And what they found was that interesting patterns emerged. In patients that rated their physicians as being high on empathy versus moderate or low, their control of their hemoglobin A1C was good. Oops, seem to be going backwards. Okay, we'll try to go forwards. For patients that rated their physicians as being moderate or poor in empathy, what we found was that their control of their hemoglobin A1C was not as good. He went on and did a larger study in Italy where he looked at the relationship between hospitalizations of diabetic patients and their empathy scores for their physicians, and this was a larger sample, 242 physicians, and then they looked at over 20,000 patients. And what they found was that the rate of acute metabolic complications for this patient base, and so this was per 1,000 diabetic patients, and the numbers of hospitalizations, they found that in the high empathy group, so the patients that rated their physicians as being high in empathy, that 4 out of 1,000 patients had a hospitalization. When they looked at patients who rated their physicians as being moderate or low in empathy, the rate of hospitalization increased significantly. So compassion has a clinical outcome. Compassion is also a benefit to employees, and the research literature is replete with accounts of the benefits of caregivers who are able to express compassion in the work that they do, are rewarded for expressing that compassion, including higher job satisfaction, less stress on the part of those employees, a greater sense of teamwork, and a lower risk of compassion fatigue and burnout. So I think organizations that are looking to recruit and retain employees, it's an important element to understand. There's some very interesting studies that have focused on the importance of strong communication skills and a relationship focus on the part of physicians and their patients' clinical outcomes. And this was a very interesting study. It looked at the doctor's bedside manner, how good their manner was, their interactions with their patients. And this was in groups of cardiac patients. And they found that physicians who had very strong communication skills, a good relationship focus, that the impact of that on their patients' outcomes was stronger than the use of low-dose aspirin or cholesterol-lowering statins to prevent heart attacks. So imagine that we could put empathy and compassion into a pill and prescribe it. Given the power that we know empathy has, it would probably be a very popular prescription. Compassion is also, for many reasons, a business imperative, and in many of our societies where malpractice rates have increased over time, where patients who are unhappy with their care outcomes bring lawsuits against physicians or hospitals, what we know is that physicians who have better relational skills are better able to empathize and be compassionate and support the emotional needs of their patients. They're much less likely to be hit with a malpractice lawsuit. We also know from some of the research that staff attitudes and the quality of human interactions are consistently identified as very important factors that dictate whether they rate their healthcare experience as being positive, and that those perceptions about the quality of relationship are also very strong predictors of whether patients will stay or leave a physician's practice. This was underscored by an interesting study that was done a couple of years ago by Wakefield Research, and this was on outpatient settings, where they looked at the percentage of Americans who felt that kindness was more important than many other key considerations, including quality. And 87% of Americans felt that kind treatment by a physician was more important than many of those other key considerations. Unfortunately, 64% also reported having experienced unkind, uncompassionate behavior in healthcare settings. And the way that they defined that uncompassionate care was failure of the caregiver to connect on a personal level. And yesterday morning, when I was talking about Plantree's founder and her experience of hospitalization, where for several days no one even called her by her name, this is a very important kind of interaction for people, that they want to feel that their healthcare providers recognize them as an individual human being, that they know who they are, that they use their name. 36% mentioned staff rudeness and 35% poor listening skills. So again, when we think about how do people interpret or experience compassion or empathy, important that we think about these different types of behaviors. This was a report in the Boston Globe a couple of years ago. There was a study looking at empathy in medical students, and very alarming, but perhaps not surprising, especially to many of you who've been through medical school. They found that the medical students' empathy scores fell between the time they started medical school and the time they graduated, and that most significant drop occurred in the third year, just as they were beginning to see patients. So something about the way we're educating our medical professionals is impacting their ability to show empathy and to relate compassionately to patients. And that's a very important responsibility for all of us that perhaps are involved in medical education to begin to address. This was a study that just came out earlier this year. It looked at surgeons who are rude to patients. And of course, none of us in the room are rude surgeons or no rude surgeons. There are a few of them out there. This was findings among 32,000 patients who filed unsolicited complaints about their treatment by their surgeons. And this was just one example they gave. This was a man who shared this response when he asked the surgeon about his wife's upcoming surgery, and the surgeon's response was, "Look, your wife is going to die without this procedure. If you want to ask questions, instead of just allowing me to do my job, I can just go home and not do it." So this sort of response, perhaps by someone who's feeling stressed or not understanding the potential impact of this interaction with a patient's family member, is the kind of experience that we're talking about. And so understanding that this sort of behavior has implications for clinical outcomes is extremely important. We cannot separate clinical or technical skill from our human relations skill when it comes to the impact on the patient's experience and patient's clinical outcomes. So think a bit about, in your own situations, in your own experience that you've had, either as delivering care or perhaps having care delivered to you, and thinking about things that you see, that you've experienced. Can you think of the kinds of things that convey to you that someone in a healthcare setting in particular is expressing compassion and empathy? What sorts of things? Because what we do know, again, from the research literature, is that it's often very small gestures have a very large impact on the patient's experience, on the family's experience. And these are some of the things that research has found that convey compassion to patients in clinical settings. Staff going out of their way simply to greet and acknowledge the patient's relatives when they are there with them. And I cannot tell you how many stories I've heard from patients' families who have said, "I was in the room with my partner or my family member, and the medical staff came in, and no one acknowledged that I was even there in the room." Now imagine, this is the person who's your care partner, should be, as we talk about it, an important part of the care team, and yet we continue to not acknowledge their existence and their importance. Staff taking the time to ask questions about what mattered to the patient. This is seen as an act of compassion. Perhaps in a terminal patient, asking them which side they prefer to lie on. How are they most comfortable? Staff taking the time to explain things in the healthcare environment that may be alarming to patients. Explaining, for instance, why is this machine beeping? Often patients interpret that as some sort of negative event, something that may be hurtful to them. So understanding that people are in an alien environment, that they don't necessarily understand what all of the equipment is for, what the significance of alarms are, and staff simply acknowledging that perhaps a kind word, a word of explanation, is seen as compassionate. Staff offering patients hand washing facilities after using the bedpan, whether or not the patient was involved in wiping themselves. So again, common courtesies that in any other setting we might think to do, and yet sometimes in healthcare, because it is very intimate and it is very, very personal, we sometimes forget about common courtesies. Staff listening to what mattered to that patient, that individual patient, and going out of their way to provide things that that patient needed, even if it meant adapting existing policies. So this is not rocket science. This does not take a medical degree, for instance, to be attentive to, but these are things that all of us that are involved in providing care can be cognizant of. So is it possible to teach empathy and compassion to our medical professionals, to our staff that may be involved in providing care to patients? And what the research tells us is, yes, absolutely, it is possible to teach the skills that patients interpret as compassion and empathy. And there's been quite a bit of research and work done on this over the last decade now. One of the preeminent researchers in this area is Helen Reese at Harvard. She's done quite a bit of research on what or how is empathy conveyed to patients, what sort of verbal, nonverbal, behavioral skills are necessary, and certainly it's something that at Blantree we've been focused on for many, many decades, trying to help to make that connection to empathy and compassion for all of our staff. One of the ways that we've done that, and you've heard just a little bit, I think, from some of the presentations previously, is looking at the staff, making sure that staff have an opportunity to reflect on their own behavior in the clinical setting, helping them to build skills around that awareness, to understand what it feels like to be in the shoes of the patient, and to reflect on that, and how in their own work they can enhance their ability to reach out and support patients. One of the interactive exercises that are a part of many Blantree staff retreats, just as an example, is a feeding exercise. So imagine just for a moment, just turn to the person sitting next to you, and just imagine that at lunch today, you are going to be asked to sit with that person at lunch and to feed them for the first 15 minutes of lunch, and then for the next 15 minutes, they would feed you. Can you imagine what that might feel like? I know for many people it makes us a little uncomfortable, this idea that somebody is going to put food in our mouth. And in part because as human beings, one of the first things we learn to do for ourselves is to feed ourselves. And yet in healthcare environments, there are many things like feeding, like toileting, that we don't even think about. Things that we do to patients that make them feel perhaps very vulnerable, very uncomfortable, but we become inured to this in healthcare environments. So we do a feeding exercise like this to try to reconnect our healthcare workers with the sense of vulnerability that patients have, and then to think, what can I do to alleviate that in the work that I do? What we've found, which is really interesting, is after you have healthcare workers go through these kinds of experiential exercises, it impacts their satisfaction, not only the patient's satisfaction. And these were a number of surveys that were done with leaders, because everyone in the healthcare environment needs to go through this, including leadership. And this was their satisfaction at work scores following these biannual experiential learning sessions at a large healthcare system in New York Presbyterian. This was the effect on staff and patient satisfaction, so we would certainly hope patient satisfaction would go up as staff went through these retreats, learned some of these skills, and had a chance to reflect on them. This was the experience at Stanford Hospital in Connecticut, looking at both the impact on patient and staff satisfaction. And then this is more recent information, again, in a large tertiary care setting in New York City, and this was specifically physicians, where we did training on compassion coaching, looking at compassionate behaviors, at nonverbal communication, and you can see where we did both virtual modules and then experiential training, how those scores increased as well in terms of the impact on the patient's experience, on their sense of whether the staff really cared about them as an individual, and then their patient's likelihood of recommending that hospital. So empathic communication, yes, we can teach it. Much of it is rather subtle. It's nonverbal communication. It's the way that we make contact with our patients, our tone of voice, the way that we look at them. You know, I'm again reminded by a story from my own experience when my mother had experienced a stroke, was in the hospital, and two different neurologists came to visit her. And I remember the first one, very compassionate physician, sat down at eye level with her at her bedside and put his hand on her arm and talked to her, even though she couldn't communicate at that point. And I could see her making that eye contact, relaxing, listening, feeling cared for. And I remember another neurologist who came in, who stood by the door with her arms folded, kind of looking down her nose at my mother, and not making eye contact with her, but speaking to me instead at the bedside. and I could just see my mother's face just sort of totally shut down. So these subtleties do have an impact on our patients. This was actually a study that Dr. Reese did looking at the impact of this kind of training on resident physicians and the extent to which this sort of training enabled their own behavior and improvements to making them feel more at ease, to being more positive with their patients, the impact on the patients and experience of the care from these residents. Again, statistically significant improvements in both the comfort and the competency of the residents, and this was the residents, their assessments or self-assessments of their improvement in skill. So the residents felt more competent and comfortable expressing these behaviors. The patients felt more listened to, that they were getting better care. So in summary, some common characteristics of compassionate organizations: having capable and dedicated champions who are responsible for the training and the monitoring of these compassionate behaviors, having departments or care groups that model compassionate behavior throughout the organization, visible support from CEO and other senior leaders, also making your patient experience scores transparent, sharing those. And then actually, again, we've heard this terminology quite a bit, walking the talk, which means having the resources or the budget dedicated to this kind of work and realizing that it is indeed at the core of a high quality patient experience. So thank you very much. I appreciate your attention.